This week is National Medical Laboratory Professionals Week. Why is it important to point out this week to the general public?
Yeah, thanks, John, again for having me on Contagion to talk about this important week. So it is, referred to as Lab Week and National Medical Laboratory Professionals Week by our professionals. And here at Texas State, we also, really push that and promote it with our laboratory majors, which is part of the conversation today. And that is in light of the pandemic. And really before the pandemic, the medical laboratory has really been working on recruitment and retention and finding ways to raise the awareness and the visibility on our profession. As you know, and many people know, in our profession, we're not patient-facing professionals. We're not dealing with patients like a nurse would or a physician would. And so, your aunt, your grandmother, even high school teachers and guidance counselors, and for that matter, even college advisors, do not always understand that our major, medical laboratory science, can be found at the associate's level. You can find it in a four-year degree like mine here at Texas State University. And then there's various master's programs. And now we have three really interesting doctorate in clinical laboratory science programs at Rutgers, UTMB Galveston, and at Kansas Medical School. So even that higher level, a doctorate level that actually rounds with physicians to kind of help interpret and predict the best laboratory medicine tests to order. And so it's just a really important time, and we want to celebrate. It's certainly been 2 years of unbelievable stress in the medical laboratory. And again, all healthcare professionals, kudos to really surviving, if you survived. It has been challenging, it's been frustrating, it's also been uplifting, and some of the most important time of our lives in healthcare. The pandemic, I think, is the most important global health event in 100 years, if you go all the way back to the influenza pandemic of 1918. And so our professionals were the foundation of providing those laboratory results. So it's just a great time to celebrate, but also thankful for channels like yours to shine that light of awareness and visibility on this profession and work towards really bringing in more outstanding high school students and transfer students and community college students and anybody out there that's interested in diagnostic detective work to really give our major a look, because it is one of the most outstanding career paths you can move into.
Absolutely. And in thinking about it, I know we're really talking about bringing people in, and one of the ongoing challenges in the field has been a shortage of personnel. What are some of the root causes for this?
Yeah, so first of all, just some of the root data, which is sometimes hard to get because we don't actually have national licensure. We have state by state. And so sometimes it's actually hard to know how many medical laboratory professionals there are. But if you look at the data we have, there's probably 300 plus thousand medical laboratory professionals at any different level. And so when you break that down for 330 plus million citizens, you can see that there's not a lot of us out there for individual people. Most people have 42 lab tests in their lifetime. And so, if you get into numbers and you're a numbers person, it really gets kind of scary because you're looking at a crisis for shortages, as you mentioned. So staffing, as I mentioned, it really was a problem prior to the pandemic. We've been dealing with this for probably a decade or so, and there's a number of factors we could talk about today. Some of the more common ones are, again, we are not patient facing. That's just one issue we're going to always deal with. It's incumbent for people like me, people like you, and others that work in this area to help high school and junior high and even early college students understand this major. It is a fantastic major. Unfortunately, many of the applicants to my program are post-bac. They go get a biology degree, they get a chemistry degree, they get other types of degrees and realize they cannot work in a hospital. I'm a perfect example, John. I had a microbiology undergraduate degree and a master's degree in virology with a thesis on poliovirus, and I could not get a job in a hospital in Texas because I didn't go through an MLS program. And you really need to go through a NACLS accredited program that makes you eligible for our certification. And again, that can be at different levels, associate, bachelor's, and so forth. That's part of the issue, just visibility. The other issues are some programs have went away due to issues like funding for educational programs. So this is a national, it's actually one of our legislative agendas we talk about with our lobbyists and things like that. But some states have no programs. Nevada has 1 or 0 now, and there's other states like that. So we actually get students from out of state competing with Texas students for slots in our program. So just the number of programs can be a problem. Texas is fortunate. We have 13 or 14 bachelor's level programs and a lot of community college programs. So we're kind of fortunate. But even then, the next issue is we have selective admission. And that's because our students, unlike a biology major or a chemistry major or a philosophy major, our guys go out and do clinical rotations in their senior year. It's required through our accreditor. They must do a certain amount of clinical hours. And as you might suspect, even before the pandemic, that's an issue because we had staffing problems already. When you start talking to hospitals about taking a 1 or 2 students to complete a clinical, they may not be able to handle us because of staffing problems. They just don't have the people to help train that student, or they're dealing with other schools, so they have other students there. So we're competing with each other. Or the latest issue has been free agency. So the pandemic, in one way, has been helpful. People know about us, they want our people now, but they're becoming travelers. And so, an alum of mine that's been out 3 years that's doing a great job, another state may dip in and say, hey, we'll give you a $20,000 sign-on bonus to come to Michigan. We want you to stay here 2 years for that money. Great for that person, but it leaves a hole of experience in that place, and again, create staffing issues. So even though it's great for salary, which we want, we need better salaries, it does create some issues that I'm calling free agency. It's like anything else. Free agency is good, but it can be very difficult when you lose all your seasoned veterans. So that's some of the bigger issues. There's some other minor things like consolidation of hospital services, where big hospital systems only have 1 lab now for 5 of their smaller hospitals. So sites to place students, that's probably the number one limitation, is that because requirements are for you to do clinicals, I can only take 20 students a year because that's about the max I can place. I have 30, 40, 50 applicants. I'm turning down pretty good students because I can't place them. I can't get them through the program. So that's probably the number one problem on staffing issues. And it kind of percolates all the way up to the hospitals and employment.
Yeah, absolutely. There's some really good points there in talking about some of the issues. And, obviously COVID-19 put a tremendous strain on laboratory professionals. Can you talk, Doctor, about the effects of COVID-19, and are the lab professionals still feeling it, the effects of it 2 years later?
Yeah, boy, talk about the elephant in the room. That has absolutely been an issue. As I've written about and talked about and preached about, our professionals conduct almost 14 billion laboratory tests every year. So that's just in a normal year. During the pandemic, at last look, if you look at like Johns Hopkins and some of the other data sources, we believe we have also added on top of that number over 1 million COVID tests. And it's just been what the public, I think, John, doesn't understand sometimes is you just don't pivot to just doing a new test. So one of the critical things for the public to understand about the medical lab is you need us in a quality control way to bring on tests the proper way that are FDA approved or EUA FDA approved. There's a process. You have to correlate, you have to validate testing, You have to do quality control standards every day, if not multiple times a day. You just don't want your medical testing popping up on every street corner with, kind of pseudo standards. And it's, I always use the analogy of airplanes. You only really see the airline pilot, you see the flight attendants, you see the ticket taker, but you better have licensed, qualified ground crew and mechanics working on that plane. We are the ground crew for healthcare. We are the foundation and the backbone for keeping quality patient care there. And I'm telling you, John, we say this all the time in our field. People don't really understand the impact of what would happen if you had kind of a willy-nilly kind of testing environment where anyone could run the test and they don't have the background and quality control and statistics to validate tests, and you just start throwing things around. Even home-based tests, make us worry because people are people, right? We all do it. You may let your test sit on the dashboard of your car in 120 degrees for 3 weeks and then do it. It's probably not valid anymore, or you may use your nostril instead of your mouth because you didn't read the instructions. I mean, there's just issue after issue that you really want quality control around your medical testing. So those are, some of the issues with respect to that laboratory professional need. And the pandemic, in many ways, has exacerbated that burnout and being tired and overworked. I mean, some of my alumni have reported working 12, 14 days in a row, 12-hour shifts. They're sometimes being told they just can't use PTO or time off, so they're going to have to wait and postpone. So like everyone else, and we're not unique, mental health, mental stress, seeing an environment where families couldn't visit their family or friends that were dying. I mean, it's been a challenging, stressful time. And thankfully, I think we've taken the hit. We've done the best we could. We're pretty resilient, but we are tired. And so thankfully, right now we were just talking about, we're kind of and kind of that curve has come way down and things are looking pretty good right now. So we're holding our breath that things are going to be pretty stable in the coming year, but we're ready. We always have to be ready to gear back up. And hopefully if we do have to gear back up, it won't be near as bad because now we understand the environment, we understand the supply chain issues, we understand how we need to validate things going forward.
Yeah, and although it's important to point out, the significant challenges of the personnel shortage, is there potential solutions that could help alleviate this? I mean, there's sort of some things that in terms of maybe some bigger kind of bullet point things that we can do to help turn the tide, if you will?
Yeah, I mean, there's really big things that, we talk about. So ultimately, and everybody needs this, but ultimately we would love more support at the legislative level for program building. This includes, John, faculty salaries, guidelines around that, because even for me as a chair, it's difficult to find faculty. I have a couple of retirements coming up and I'm dreading it. It's really hard because it's not just finding, I can't hire a PhD. Let me put this on your plate. I can't hire a Nobel laureate in microbiology if they are not credentialed as a medical lab scientist. They can't even teach my lab because they have to have those credentials. It'd be like hiring me to teach your medicine, like medical school. You just can't do it. It takes a certain person, credentialed and experienced. So that's part of it. We need more programs. We need better salaries. We need ways to get faculty in and students in. So that's part of it. Another part that we would like at the legislative level would be some help with more scholarships and financial aid, loan forgiveness, perhaps, even if it's just a percentage. This isn't unique among most majors. The problem we think with ours is that our curriculum, so for example, in my 2-year curriculum, it is so rigorous. Every course has a lab. Students are in class from 8 to 4 or 5 every day. Then they're doing clinicals, sometimes for 3 to 4 weeks at a time, where they don't get paid. They cannot be paid for clinical work. for their internships. So they can't work, John. They can't go to, Target and put in 30 hours a week like some college students. They're exhausted. They have to study like almost no one else because they have to retain all of this information for their credential exam. So we need help. We need help for our students just simply on the financial side. Those are some big things, probably two of the biggest things that I would push towards the top. And then the short-term stuff would be like we did during the pandemic. At some point, you have to reach back into the retirement groups and say, hey, we're in trouble. Could you come back and give us a year, of time? You're experienced, you're certified. Can you please come back, even if it's 20 hours a week, and give our guys a hand? Can we get, there are some programs out there that are utilizing, say, a microbiology major will come in and they will work with someone like Weber State. I wrote an article about this with ASM, where they can be a micro major, but in that route, they will take just enough coursework with a program like mine, do just enough clinicals to satisfy accrediting, and they can graduate with a categorical microbiologist certification so that you can hire these people right away. So it's kind of another short-term fix. Ultimately, we need them to be MLSs, which are generalists in all areas of the lab, but it also helps to get specialized people in place. So those are the types of things, along with just ongoing visibility and awareness down into the junior high and high school levels. You hear all about STEM programs. They get all kinds of grants. That's awesome. I love STEM, but that doesn't come to programs like ours. We're kind of lost, if you will, in the system of congressional help. We're not really medical school. We're not really STEM. We're kind of in the middle, and so we just get forgotten sometimes. So again, awareness.